welcome to my YouTube channel. Let's Join Pharmacy. In this video, let's discuss about the Betnovate-N cream. Actually, what is this Betnovate-N cream? You are observing on the picture here. This is the Betnovate-N cream. Today in the market, this cream is very popular, but actually many misuse done by the customers, patients by this Betnovate-N. So my request to all my dear viewers to please watch this video until last. Maybe it changes your lifestyle condition. Here in this video, we will discuss about the composition of this Betnovate-N, what actually this Betnovate-N contains, and the actual uses of this Betnovate-N, some side effects, contraindications for whom we cannot give this, then how to apply. These all things we will discuss in this video. First, you understand the Betnovate-N, it is manufactured by the GSK company laboratories, and the MRP of this Betnovate-N is rupees 55 rupees. Okay, it may or may not goes ups and downs, but the today's generation in now today's price it is 55 rupees. Composition of this Betnovate-N, simple composition, it contains betamethasone and neomycin. It contains betamethasone and neomycin. You are observing here the betamethasone, it is a steroid. What is it? It is a steroid, potent steroid. What is steroid? How actually the steroids work? I have made one video on that. The link in the description. Go and watch that. Why the steroid should be used, for whom we cannot give the steroid, everything is present. Yeah, the uses of this betamethasone is, see, it is a potent steroid used for the treatment of skin conditions. Yes, skin conditions. Which are the skin conditions we can use this Betnovate-N? Only for eczema, dermatitis and psoriasis. Eczema patients, dermatitis and psoriasis. Okay, these are the skin conditions, severe skin conditions. Okay, there we will use this betamethasone and neomycin skin cream. Now what is this eczema, dermatitis, psoriasis? In the next slide I will show you the pictures, then you will get a complete knowledge on this eczema, dermatitis and psoriasis. Except this cream should not be used anywhere. Yes, okay, except your doctor prescribes you. Many are using. Where they are using, I will tell you in the contraindications where they are using and why they are using. You got it? What is the actual use of this? Yeah, see, this condition is a dermatitis. You are observing, this is a dermatitis. Actually this dermatitis, psoriasis and eczema, they looks like similar, but a slight difference is there. This condition is the psoriasis and this is the eczema condition, and these all are the chronic type of the conditions, skin conditions. Only there we can use this betamethasone. Psoriasis and eczema, you are observing here. In psoriasis and eczema, the major difference here is psoriasis. These psoriasis, they are having the double layer looking like skin. Means they look like having the double layer. And here the psoriasis, they are less irritable when compared to eczema. But eczema, they are very irritable, very itchy in nature, very dry when compared to the psoriasis. Okay, remember psoriasis, it's not itchy, mild itchiness, mild dryness, but eczema with intense itchiness and intense high dryness. These are the major difference here. And in psoriasis you will observe the burning sensation, and in eczema there is no burning sensation. Okay, you will feel like a very dryness, very itchiness in the eczema. Both the condition are very critical only. Very critical means they are we cannot cure this disease permanently, but we can maintain the symptoms. How can you maintain the symptoms? By using this Betnovate-N on the prescription of your doctor. Are you getting what I am telling? Dermatitis, psoriasis and eczema, these are the simple difference. Side effects by using this cream, see, itching may be followed by some patients, burning sensation also, then skin thinning and intense spread of infection. See, psoriasis, one more difference is here you will observe the burning sensation, and here the burning sensation is absent in eczema. Intense spread of infection, there is a chance of again spreading of the infection, which that by applying this betamethasone, because betamethasone, it is a steroid base. Next, contraindications, see, you should not avoid on face, but in today's modern everyone is applying on the face. Actually, while you apply on this face now, for 3 to 4 days after application of this, your face will turns to bright in nature. Then what the consumers, what the customers, or what the who will using this cream for your skin on the face, they will think that, hey, it is very good cream, we can use on the face. It is removing all the dark circles, it is removing all the hyperpigmentation, it is removing the pimples. Yes, definitely it will remove, because it is a steroid. But they don't know what happens if you leave this cream. If you leave this betamethasone or Betnovate-N cream for 5 days, only 5 days, your skin conditions may be returned to same, or it become worsened than the previous one. It get completely destroyed your skin. Yeah, definitely I am telling, because many patients, while I am seeing, they are some pharmacists, what they are doing, due to their half knowledge, due to the devil's knowledge, what they are doing, they are giving this Betnovate-N to apply on the face. So my request to all the viewers, those who are watching my cream, any drug, any medicine, don't go and directly purchase from the medical shop. Okay, you go through the practitioner, you go through the medical practitioner, means who is very authenticate and who is very prompt, and he is a MD in particular field, then only you go and contact him. He will guide you in a proper way. Don't go and directly ask in a medical shop. Okay, see, because it is a very danger. You will think that it may goes. Yes, definitely it will goes, because it contains the steroid. If you apply on the face or anywhere, it will goes in 2 to 3 days. But if you leave that cream, again it will comes. So it should be avoided on face. Not to use in baby less than 2 years. It is also very important. You should not use in the diaper rash or anywhere. Then not for acne vulgaris. Acne, you should not use this betamethasone, and not in fungal infection also. Fungal infection, many pharmacists, they are giving this with the fungal infection. Okay, in 3 to 4 days your fungal infection will be disappears. But after the 1 week after you leaving of this fungal infection medications, again it comes, and it will comes by thinning of the skin. Completely your skin will get thins, and the veins are absorbing. Okay, you can easily see the veins. Okay, because continuous application of this will make your thin very thin, make your skin very thin. Okay, so it is one of the very dangerous side effect of this steroid. And not in vaginal use, you cannot use here. Yes, then how to apply? Apply 1 or 2 times daily for 7 days, lightly on the skin. You should apply lightly, very light. You have to apply on the affected area 1 or 2 times on the basis on the doctor prescribe. But for the knowledge purpose, you remember 1 or 2 times you can apply, and apply with moisturizer to prevent side effects. It should be applied with the moisturizer. Moisturizer will prevent the dryness or itching of these steroids. Then if condition is good, then if condition is not good, after 7 days contact your dermatologist immediately. Do not use more than 14 days unless your doctor says you. This cream should not be used for more than 14 days unless your doctor says you. These are the points you have to remember in your mind. Okay, from beginning only we have studied everything. So if you having any doubt, means if you are feeling any clumpy, any doubt, means you can ask me in the comment section, and try to rewind and watch this video. Then you can get complete idea of this. If you like this video, then like our video and subscribe our channel Legend Pharmacy. Thank you.